Good morning. I want to welcome you to our Friday press briefing with updates on COVID-19. Please join me in a moment of silence for the lives we've lost due to COVID-19 and for the families they leave behind. Thank you. Now we'll hear updates from our community leaders, and first we'll hear from City of Albany Mayor Bo Durrell. Mr. Mayor.
Thank you, Chief. Good morning. I will speak briefly about the current spike in infections and deaths, and will then provide you with some information regarding approval of a vaccine, a development which has been anxiously anticipated. Since November 4th, in the United States, there have been over 100,000 new cases each day. The number exceeded 200,000 on December 2nd and December 3rd. I referred to a model several months ago which predicted that the death toll would exceed 300,000 by the end of the year. The death toll now exceeds 176,000. There were 2,597 deaths on December 1st, 2,658 deaths on December 2nd, and 2,857 deaths yesterday. The last 3 days have been the deadliest stretch since the pandemic began. The current situation, which is being referred to as the third surge, is obviously worse in some areas than others. Regions of California are expected to be placed under a new stay-at-home order within the next few days. Unfortunately, the increase in the number of infections and deaths is expected to continue throughout the holidays. The CDC has recommended that Americans not travel this Christmas. Here in Georgia, hospitals in 9 of the 14 regions are approaching capacity, with up to 90% of the ICU beds occupied. Governor Kemp has extended the public health state of emergency, including the current restrictions, through January 8, 2021. Here in Daugherty County, the 14-day rate at 103 per 100,000 residents has exceeded the threshold for enforcement of the mask mandate. The mask ordinance will, accordingly, be enforced in the coming weeks. The FDA is expected to consider granting emergency use authorization to a vaccine on December 10th. This vaccine, developed by Pfizer and a German pharmaceutical company, has proven to be 95% effective. Vaccines typically take several years from initiation of the development effort to an approved product. The development of this vaccine in approximately 10 months is unprecedented. Pfizer and other pharmaceutical companies, which are also developing vaccines, commenced manufacturing during earlier phases of testing, when the indication was that the drug would successfully combat the virus. Historically, medicines are not manufactured on this scale until the drug is approved. Pfizer has announced it can make an initial delivery of the vaccine within 24 hours of receiving emergency use authorization. The vaccine or vaccines will initially be available in limited quantities. It is expected that healthcare workers and residents of long-term facilities will receive priorities, followed by first responders and law enforcement, and then by the elderly and those with serious underlying medical conditions. The supply will increase in the coming months and is expected to be widely available and distributed by the spring. The vaccine must be stored at very low temperatures, almost 100 degrees below 0 Fahrenheit. Hospitals and health departments throughout the country have, for some time, been making preparations for administering the vaccine. This was necessary as, eventually, hundreds of millions of Americans must be vaccinated. I assume Phoebe Putney and the health department have, or will soon have, the necessary cold storage equipment. Everyone, including those who have tested positive for COVID-19, are being advised to be vaccinated. A second shot will be administered within 3 to 4 weeks of the initial vaccination. Testing confirms it takes 2 to 3 weeks to develop immunity and several weeks for the full antibody response. The vaccination will be available at no charge to the patient, though facilities administering the injections will be entitled to a fee. It is expected that the federal government will incur this expense. We will need to continue to protect ourselves and others in the coming months. We know we can do this by practicing the safety precautions, including wearing a mask or face covering. Thank you.
Some of the data that we have here in Daugherty County. Currently, our results are showing a total positive is it a huge difference? No, it's not a huge difference, but it is consistent with an uptick in the overall number of cases. Now, I also say that to say this: we are also not currently a hot spot in the state of Georgia, which is a good thing. However, we have experienced an uptick in the overall number of cases that we have here in the community. Why has that probably happened? I would suspect that we had a lot of people that got together over the Thanksgiving holidays, and I think it's very important that we continue to remember what we need to do during this time. And I think it's important for people to understand and realize what happens in the transmission of this virus. You get people together and they either do or don't know that they actually have the virus. Perhaps they haven't interacted with some of these folks, and then they transmit it to someone who either does or does not display symptoms. And then that person becomes infected with the virus, and then they move on and interact with other people. And if they're not engaged in social distancing, they're not wearing a mask, they're not taking the necessary precautions, then it then continues to spread. Why is that significant during the holiday season? Well, you have Thanksgiving, which is approximately about 5 weeks away from Christmas. These are both events where we know people continue to get together and spend time with friends and family. During that time, the virus can spread and be transmitted to a large number of different people because people are gathering with different folks that perhaps they haven't been gathering with over those time periods. And so that's important to understand that the holiday season can literally provide an opportunity for the virus to proliferate, to grow, to expand in a very significant fashion. We have not experienced that in a truly devastating fashion like we did at the very beginning of this pandemic. And certainly our results in terms of healthcare and our healthcare results are way better than where we were at the beginning of the onset of this virus. However, we still need to continue to be diligent. We need to remember, and we don't need to sit in panic and anxiety. We just need to exercise the diligence that we have continued to exercise, and frankly, that brought us out of an apocalyptic situation where we were at in March and April of this year. As we look at this is showing the overall positive percentage of the state at 9.2%, and unfortunately, Daugherty County, as we know, is in the red in comparison to many other counties in the state in terms of deaths. And I want to explain that data. We experienced an extraordinarily high number of deaths at the very beginning of the onset of the virus. Our overall rate of death has gone down significantly, and I'm very thankful for the healthcare partners and the results that they have been able to produce that have lowered that rate of death, and that there are so many more people that are leaving our hospital here in Daugherty County. They're leaving. They're not dying, and so we have so many more good and positive results that are happening there. But I do want to remind people that it's important for us to also remember what we've been through so that we can continue to be diligent on a moving forward basis. And we know the things that truly work. We've talked about them again and again and again. And I want to turn our attention for a second concerning the information that's been released about vaccinations. I'm very thankful to hear about the numerous vaccinations that are, or vaccines that are becoming available. Obviously, we're asking some very aggressive questions about how that may or may not become available to our community. I'm also very thankful that Phoebe Putney Memorial Hospital has already been very proactive and taken our requests very seriously in going ahead and making sure that significant preparations have been made. They've already invested in the necessary coolers and freezers that are very, very specialized in order to be able to store vaccines to be deployed here in this community. And I will say this, many other communities do not have hospitals that have the capability that Phoebe does to be able to deploy the capital necessary to purchase these types of assets, which will ultimately centralize vaccinations here in this community in a very meaningful way. It positions us, as we have been positioned with respect to numerous other disasters, because we have been ready, because we have been prepared, and because we have taken proactive steps. That will position us, Albany, Daugherty County, as a leader in the region for purposes of receiving very important assets for our community, our citizens, our elderly, our medically fragile. And so with all of that, again, I'm very thankful for the progress we've made. I'm conscientious of the fact that we have had an uptick in the number of cases. We have had an increase in the overall number of people in the hospital. We continue to enjoy the benefit of great healthcare results, a low number of deaths, a low death rate. But again, any one death is too many. Again, please think about these things as you move forward into the Christmas holidays. Be mindful of how many people you are gathering with. Consider not traveling unnecessarily. Again, there are many ways to connect with different family members that are out there. And everyone has the right to make their own choices, but please do be conscientious. Consider wearing masks, consider social distancing. When you're in family gatherings, don't get large groups together, and consider utilizing technology in order to connect with many family members that may fall into those medically fragile categories. I thank you all for your attention.
Thank you, Mr. Chairman, for your remarks today. We will now hear from our representative from Phoebe Putney Memorial Hospital. We are joined today by Dr. Stephen Kitchen, the Chief Medical Officer, Phoebe Putney. Dr. Kitchen.
Chief, thanks so much. And I'm going to do a couple of things today. I will first of all provide an update both for Phoebe Putney Memorial Hospital and for our health system at large regarding the COVID-19 activity, and then to kind of dovetail on the comments made by our mayor and the chairman of our county commission. I want to spend a little bit of time talking about where we are with vaccine development, distribution, and that sort of thing, because I know it's going to be a subject of intense interest going forward at this point. So I know, the last several times we've had the press conference, I was very happy to report to you that in terms of the trend that we were seeing in terms of the number of patients requiring hospitalization across the Phoebe health system, that had been a very favorable trend that really we saw throughout the month of October and November. In fact, our number of daily, our average daily census for COVID-19 patients hit the historical low during the month of November, numbers that we had not seen since the onset of the arrival of the pandemic in Albany in March. And so what I will tell you is that this time a week ago, we had 24 patients who were hospitalized with COVID-19, and we definitely, and we were averaging basically 2 to 3 new admissions a day. And, you know, we began to see a gradual uptick in that last week. And really yesterday, we had the highest census that we had had. But as of today, there are now 45 patients hospitalized in the Phoebe system with COVID-19. 44 of those are at Phoebe Main and 1 at Phoebe Sumter. Of those 44, 9 are patients that we have received from outside facilities, and that's out of our immediate primary service area, which would be Dougherty County, Lee County, Sumter County, Worth, and that sort of thing. So like I say, 13 of the patients we currently have in our health system are transfers that we accepted from outside facilities. And I will tell you, you know, it's not, those facilities aren't just in Southwest Georgia, they're throughout the state. Most of them are in the southern part of the state from Macon or below. So, you know, certainly that is something that we have taken notice of, and I think it certainly underscores, as both Mayor Dura and our chairman of the County Commission have pointed out, this is certainly the time that we need to maintain the vigilance that we have with regards to those measures we know to be effective in terms of masking, social distancing, and avoiding large crowds. And as the slides up here will show you, the one that's farthest to the right that says Phoebe Albany shows the number of new patients with COVID-19 we have admitted on a daily basis. And like I said, we were averaging 2 to 3 a day. And you see over the last week or so that those numbers have certainly trended up at this time. In terms of, you know, the other thing I look at is out of the number of patients or individuals we test on a daily basis, what % are testing positive for COVID-19? We had seen a very, very stable trend over a month or more. We're really about 5% or less were testing positive for COVID-19. It's now averaging about 9 to 10%, which is, you know, certainly in line with what Chairman Cohilas reported and what is being seen statewide. So, you know, I think what we know is this this uptick is certainly not limited to Albany, Dougherty County. I know that Tift Regional and Tifton is seeing the same thing. Southwest Georgia and Valdosta is certainly seeing a trend and an uptick as well. So, like I said, I think it just certainly underscores the fact that the measures we've talked about time and time again are effective. I know it becomes more challenging this time of year for a number of reasons. When the weather gets colder, obviously people are going to be indoor more, and so we know that the propensity for this virus to be transmitted is going to be higher in indoor spaces as opposed to outdoor. I do want to, like I say, spend a little bit of time talking about vaccine development, distribution, and more importantly, how Phoebe is really positioned at this point. And I do want to point out the fact that we are working in close concert with our state officials, the Department of Public Health, but also on a federal level as well, to make sure that we work in concert with the federal and state agencies with regards to the availability and the distribution of the vaccine. We stood up a Phoebe vaccine planning team several weeks ago. Julie Miller, who heads our emergency preparedness team, has a very strong background in public health, leads that, and Scott Steiner, our system CEO, is certainly taking a lead with that. But we also have a community COVID-19 vaccine task force, and that's working in concert with several of the local physicians, our primary care physicians, to, like I say, make sure we are positioned to the best of our ability when a vaccine does become available and it's distributed to us, that we can get it to the people who need it the most in a timely fashion. So there are a number of vaccines that are going through what are called clinical trials right now, and there's 3 phases of those. And as Mayor Dura has already spoken to, typically normal vaccine development takes years. Obviously, with a global pandemic and the urgency of the situation that is at hand, that process has been expedited in a remarkable fashion. It truly has. Center to all that, though, is that we can never sacrifice safety and efficacy at the expense of trying to expedite a vaccine development. And certainly the pharmaceutical companies, have a considerable degree of due diligence they put, but our Food and Drug Administration, the FDA, really has the final approval of those. And they have made it very, very clear that in no way is safety going to come at the expense of expediency. But that being said, this is a process that is going on 24 hours a day right now. So I think the likelihood is very high. There are going to be 2 vaccines that are approved by the Food and Drug Administration within the next 60 days. The first of those has already received emergency use authorization by the FDA. That is the Pfizer vaccine. I was on a statewide chief medical officer call with the statewide medical association Wednesday, where an in-depth discussion about the Pfizer vaccine took place. And what I will tell you is this. Pfizer is certainly in a position, they feel fully confident that they can manufacture and distribute millions of doses of that vaccine. And it will be administered in 2 doses, 21 days apart. This is a vaccine that does require what is called cold storage. It has to be stored at -70 degrees centigrade. So that requires a special type of storage device to do that. And again, I just have to commend the leadership at Phoebe that really anticipated this months ago. So what I will tell you is that we have already procured 3 cold storage units at this point. One will be at Phoebe Putney in Albany, one will be at Phoebe Sumter in Americus, and one will be at Phoebe Worth in Sylvester. So I'm very confident that we will have the capability to storage and maintain probably all the doses of the vaccine that we will be administered. My understanding at this point, in terms of the distribution of those vaccines, it is going to be orchestrated on a federal level by HHS, Health and Human Services, which in turn will distribute those vaccines to each state. The state will in turn decide what the allocation will be, and I don't think all the details have been worked out at this point, but I'm sure that basically the overall population and to some extent what vulnerable populations are going to play into whatever that decision is. My understanding at this point for long-term facilities, nursing homes and that sort of thing, that I think both CVS and Walgreens is going to be on point for that. So I think they're going to be in a position to make sure that residents of long-term facilities and other vulnerable populations are going to be high on the priority list for vaccine administration. Certainly it's been well recognized at this point that healthcare personnel and first responders are going to be probably at the top of that priority list. And I will share with you one thing. Whatever the most challenging aspect that all hospitals are undergoing right now in terms of the COVID-19 surge and hospital capacity is making sure they have enough healthcare personnel to care for patients with COVID-19. We can be very creative in terms of beds. I'm very confident in terms of ventilator capacity. We're very well positioned there. But the most challenging aspect for Phoebe and for every hospital, not only statewide but nationally as well, is making sure that we have enough physicians, nurses, respiratory therapists, and other critical frontline personnel. And so I think the decision to make sure that first responders and healthcare personnel are high priority on the vaccine administration, I think makes a whole lot of sense. The last thing I will say is this, is that, like I say, I think, certainly the recognition that we need a safe and effective vaccine available as soon as we can, I think goes without saying at this point. And like I say, that the safety has to be assured to the best of our ability. I know sometimes there is some skepticism or reluctance for people to receive vaccines, and I fully recognize the point that it is a matter of individual choice, and that that patients' rights need to be respected over all, over everything else. But at the same time, I think we have to acknowledge that we really do have a real public health major threat on our hands, and that I think the best way to get on the other side of this is through the availability of a vaccine that's widely available and safe. So, I guess my admonition to everyone would be really be receptive to the availability of a vaccine, and I am confident over the course of the next year there's going to be a number of vaccines that will become available to the public at large. So thank you for your time today.
Thank you, Dr. Kitchen, for your update. Today we will move now to the Department of Public Health. We have with us today Dr. Charles Ruiz, who is the Director of the Southwest Georgia District. Dr. Ruiz.
Thank you, Chief. The previous speakers have all shared some very good and accurate information. Many of the notes that I came prepared with have already been covered. I would like to say another word about the vaccines to add on to what Dr. Kitchen has already said. I suppose a lot of us are eager to get the vaccines in the community and to get our vaccination for ourselves and for our families. And I would also add, just in a nutshell, that I believe the vaccines are going to be very safe and quite effective. I'm looking forward to getting my own COVID-19 vaccine series. But even though I work for public health, I do not know when I will get mine, because I don't know when it will be available. I don't know when my colleagues will be able to get theirs. So I think the best idea is just to sort of celebrate the fact that some of these pharmaceutical companies have done a great job in their research and in their manufacture of the vaccines. We're hopeful that the Food and Drug Administration will see fit to fully approve their use, and we hope that soon the vaccines will be ready to ship, and then soon after that we can start using them. I would like to say that once we know all of the pertinent information, we're going to be completely transparent with it. We are going to reveal to the public as quickly and as broadly as we can the final details of how the vaccines will be administered, where people can conveniently go to get the vaccines. We're going to use standard media, social media, billboards, and word of mouth, and every means that we can to make sure that everyone knows when they can get the vaccine and where and how easy it will be. There will be no out-of-pocket costs for anyone. So that's good news, something that we can look forward to. I also would like to speak for a moment about the recent uptick that we have seen throughout Georgia, throughout the Southwest Georgia Health Region, and here in Dougherty County. If we look back at the numbers, we can see that during the week of Thanksgiving, the numbers actually started going up, and our highest one-day total so far in Dougherty County in recent months is November the 30th. And we're hoping that's the spike and that it will continue to go down from that point on. It is likely that the uptick is due to the behavior and the choices that we've made. We can't change that going backwards, but we can recognize that exposures probably have occurred during the past week, and some of those folks who were exposed may not even be symptomatic yet. So we want to urge everyone to kind of self-monitor, especially if you know you have not adequately practiced social distancing. And if you develop symptoms that are consistent with COVID, please self-isolate and get yourself tested as soon as possible and consult with your healthcare provider. It can sometimes be a little bit confusing when we talk about our numbers. And one example of that is when we talk about testing. There are different types of tests. Most of the time, when we're talking about test results, we are referring to the standard test, often referred to as the PCR. But over the last few months, the rapid antigen test availability has been greatly enhanced throughout the state, and that's true also for the South Georgia region. So we're seeing more and more places and locations where people can go to get the rapid antigen test. And in many ways, that's a very good thing to have the test to be so available and accessible. However, when we talk about positive tests, it can sometimes be confusing. With the standard test, the one we call the PCR, in almost every case, those results get reported to public health right away, whether they are positive or negative. It's not the same when it comes to the rapid antigen test. Most providers in the healthcare field that perform the rapid antigen test do appropriately report those results, positive and negative, to public health. But some don't. So we sometimes get data in several days, up to a week late, and sometimes we don't get it at all. Sometimes we get the positive results, but not the negative. And I'm not pointing a finger of blame toward anyone. I'm just trying to explain why sometimes the numbers can be a little challenging to adequately analyze. So if we look at the Daugherty County numbers, look at the positive tests that we've had over the last 14 days or so, and if we look at both the standard PCR test and the antigen test, if we look at November the 2nd and go backwards 14 days, then there were 238 positive cases for Daugherty County residents. When we extrapolate that to 100,000 residents, that comes to a number of 271 over the 14-day period. And that's concerning. It's right around the state average, but I say it's concerning because for a month or two, we enjoyed numbers that were 100 or below for Daugherty County. So we can't change what has been done, but what we can do is give some thought to what we're going to do this day and going forward. And the message is pretty much the same that we have been saying now throughout the pandemic. It's very important to practice social distancing. If we stay 6 feet away from everyone else, it's very unlikely that we're going to transfer the virus or get it from someone else. Wearing a mask definitely helps to control the spread of the virus. Keeping our hands clean and commonly touched surfaces clean can help us a great deal. And one of the big things I want to talk about is staying home when you are sick. Public Health investigates every positive case of COVID that's reported to us. And time again, we learn that people develop the virus because they were around someone who knew that they had the symptoms. So if we can do those things, we can greatly reduce the spread of the virus. I do have some good and exciting news that I want to talk about this morning. If I can find the slide. I'm having some technical difficulties. I'm not sure if I'm going to. Oh, okay. All right. Well, we don't have the slide, but the news is just as good. Many people are aware that about 2 days ago, on December the 2nd, the CDC released some new guidance that provides a pathway to shorten the duration for COVID quarantining. Most people have heard that the period for quarantining has been 14 days beyond the most recent exposure to a case of COVID-19. As of 2 days ago, the CDC has provided new guidance that allows us to shorten that period to 10 days, from 14 days down to 10 days. Now, it's important to go through some details, though. For a person to come out of quarantine after 10 days, they have to be asymptomatic throughout that entire 10-day period. And for the following 4 days, they should wear a mask, they should self-monitor for the development of symptoms, and if they develop COVID symptoms, it is still very important that they switch into isolation, get a test, and consult with their provider. So as of yesterday, actually, our epidemiology staff with public health made the transition, and going forward, when we place people on quarantine for COVID, it will be for a 10-day period. The CDC in that same article also provided a pathway to further reduce the length of quarantine, possibly down to only 7 days. To reduce the quarantine period below 10 days, though, it will require a negative test. The reason why we have not yet adopted that part of the new guidance in our health district is we're waiting on a firm decision to be made on what kind of tests will be required. A PCR test will certainly be acceptable. So the remaining question is whether or not the Department of Public Health in Georgia is going to endorse a negative rapid antigen test in order to come out of quarantining between that 7 and 10-day mark. It is likely that by Monday morning that decision will have been made, and as soon as it is, we will send out a press release to update our policy. But already we have shortened the quarantine period from 14 days down to 10 days. This has no effect on the period of isolation. Isolation is still for 10 days. So as I step down, I just want to remind everyone that the pandemic is still with us. People are still getting sick from COVID-19. Some people are still getting hospitalized, and some people are still dying from COVID-19 infections. Do what you can to protect you, your family, your colleagues, and your community. Thank you very much.
Thank you so much, Dr. Ruiz, for your report today from Public Health. We will now get an update from our coroner, Mr. Michael Fowler.
Thank you, Chief. This morning, I want to give you some stats. It's been a while since I gave you some stats on hardest hit areas and the individuals that are affecting most in our community. According to our record, the ones that died in Dougherty County from the virus, had the virus, is 199. That's what the Department of Public Health have here in Dougherty County, along with myself, that we have checked, and these are the addresses here in Dougherty County. We have 199 deaths here in Dougherty County. Some of the hit areas in 31721, we have 27 deaths in that particular location. 31707, we have 38 deaths. That's in Northwest Albany. East Albany, 31705, we have 46 deaths in that particular location. And one of the hardest hit areas in South Albany, Southwest Albany, we have a total of 88 deaths in 31701 area. By race, we have a total of 1 Latino, we have 46 white, we have 152 blacks. Gender, we have 112 females and 87 males. We have one Latino male. We have 30 white females. We have 17 white males. We have 70 black males, and we have 81 black females. And our residents have died. Based on the age, our youngest, we have 2 in the age of 20, 3 in the age of 30, we have 11 in the age of 40, we have 14 in the age of 50, we have 55 mid-range in the age of 60, and we have 52 in the age of 70, we have 43 in the age of 80, 18 in the age of 90, and 1 in the age of 100. The trend from March, you'll see back in March we had 39. So sometimes the numbers come in late, so some of the numbers have changed back there because some individuals have died, and we finally got the reports in later dates. But back in March we had a total of 39 deaths. Back in April we had 86 deaths. May we had 26 deaths. June it dropped down to 6. In July we went back up to 12. August we were up to 15. Then it started dropping again. In September we had 6. October we had 6 deaths. November we only had 3 deaths. And so far in December we have 0 deaths in residents here in Dougherty County. Thank God for the last 2 weeks we have not had any COVID death here in Dougherty County that lived in Dougherty County. And I would encourage everyone to keep masking up. We hear different ones saying that I don't want to wear a mask, but I think the mask is one of the very safest methods of being safe. We guess one time, as the mayor and the commission have, chairman have said, Dougherty County was one of the hottest spots one time. Now compared to the other cities and states around us, we're looking good compared to some of them. And I think what happened, we are doing what it needs to be done, is practicing social distance, we're wearing our masks, and we're taking heed to what is being presented. So I want to say, I know the holidays are coming up, but still, again, let's be safe. Thank you.
Thank you, Mr. Coroner. We will pause for any questions today. Okay. Our next press briefing will be on December 18th, and we'll ask you to join us then. Before we adjourn, I want to again remind our citizens to please mask up. We must continue to protect ourselves, our family, our friends, our fellow citizens, and ultimately our entire community. It takes all of us working together to help fight the spread. Let's all continue in our diligent efforts. This concludes today's press briefing. Thank you.